opportunity to get in on the ground floor of a cutting-edge massage and postural therapy technique that is poised to grow exponentially, then consider training to be a neurosomatic therapist.
And here to tell us more about this exciting new field, considered by some to be the future of pain treatment, and about the benefits of becoming a neurosomatic therapist, are Randy Clark and Kevin Wade from the Center for Neurosomatic Studies. Hello, gentlemen.
Hello, how are you?
You both founded the clinic, is that right?
We did. This is the Center for Neurosomatic Studies is actually a school.
Okay.
That is it's a training program for people to get into this type of work. We do have a clinic. The clinic is the St. John Clark Pain Treatment Center. It has been doing neurosomatic therapy in the area for probably 10 years.
Explain what that is and what would be some other alternatives to this that maybe aren't quite as good.
Okay, sure. Neurosomatic therapy, it's like you said, it's a massage, postural therapy technique. It's been developed by a guy named Paul St. John. It's this type of therapy that separates itself from others in that our analysis. It really is the analysis that is different. Mm-hmm. The techniques, we have very good techniques how to treat muscles, how to balance muscles, but the analysis of finding where the problem is and then treating that, not just the symptom, is really what separates it from the others.
So this is sort of the idea of sometimes the cause is not or the effect is not the cause. What you're feeling is not necessarily the root where it's coming from.
Exactly, yes. We take a whole set of measurements, and we have this chart that we lay all of this out on. And when we're done with that, we have a picture of what's going on with someone's body. Mm-hmm. And we can see where these things come from and why someone is having pain. By taking these measurements and doing this analysis and understanding the anatomy of someone's body.
Now, Holly and I both have bodies that are just completely falling apart, and
Speak for yourself, man.
You had asked us if we were having any pain, and what I told you was that I have the top of my thigh right here is numb, completely numb, mm-hmm. and then I get this sort of burning cold sensation from time to time. So what is that?
Well, I mean,
fix it right now.
Come on,
let's get it.
You're gonna trade me places.
So here's the thing, Jerome. That symptom. There are several things that could cause that symptom. One of the things that does separate us from the other people who would go and treat your leg is that we're not going to do anything to it till we figure out where it might be coming from. Mm-hmm. And it's that analysis where we go through, we figure it out. Your knee pain could be completely different, right? Chances are you may have a muscle called the articularis genus right there that might be causing a problem, but it might be you have a pelvic flexion disorder, or it could start with a vertebra in your neck being out.
No kidding.
Yes.
A vertebra in the neck can affect your knee.
Can affect your knee, absolutely.
No kidding.
So where we separate ourselves is the fact that we find where that source is before we ever treat a symptom.
So, Kevin, before we started this segment, I said, oh, look, you've brought a pelvis. And clearly, I have a very, very base knowledge of anatomy. But it sounds like when you train technicians, therapists, they have to have a really good grasp of anatomy.
And it's where we really challenge students. We've been teaching seminars for a long time, but we've taken our educational offering to an entirely different level now with the school opening. I think we're teaching something close to 300 hours worth of anatomy. And understanding the structures and understanding the anatomy and what it does is the foundation of everything that we do.
So if someone is interested in getting on board this new type of therapy, what type of pre-education is required, and how long does it take to go through the basic requirements of your school?
Well, our program is 18 months long. So it compared to other areas of study like physical therapy, things like that, it's a short amount of education. Those programs will take you 2 or 3 years to get through. What we require is that they're a high school graduate or have a GED, they're 18 years old. We're really looking for folks who have a little bit of experience in post-secondary education. So an associate's degree, maybe a bachelor's degree, maybe have a little bit of work experience. Those are the people we find that do really well at this work and excel.
And speaking of people who do well and excel, I mean, this program, it sounds like for 18 months and getting to know and learn as much as you do, this is very intensive. So what kind of time commitment are you looking for?
Sure. The program runs from 8 to 12, Monday through Friday. So it's only a half-day program, and people can work if they need to while they're going to school. We will have an evening student clinic as well, 1 day a week. So there's a little bit of evening time, but it's it is an intensive program. But we've kind of structured it in a way that people can continue to earn an income while they're going to school, and then be ready for this career that they can jump into right out of school. I mean, we know a lot of people are looking for jobs these days, and a lot of people are going through a bachelor's program and not able to find work, right out of college.
Right.
But this is an extremely in-demand kind of skill.
Yeah, maybe
we
we'll
have
get it.
we have people calling our school already. We haven't started our first class yet, and they are telling us, doctors' offices, other therapists around the country, we want to hire your people.
Well, it seems like in this economy, the one type of job or the field that really hasn't suffered at all is the healthcare field. There's an incredible demand for that,
especially in pain treatment.
Definitely.
Yeah. What do you hope to hear from students?
Sure.
5-10 years from now. Do you think some will come back and wow?
Well, yeah, 5-10 years from now, I mean, this field is going to be much larger than it is right now. The way pain is treated currently is not really the greatest model. Your options, if you go to the doctor, typically are surgery or drugs. This is that next piece.
Cool.
Even there's physical therapy, there's surgery, there's drugs.
Cool.
We have this what we feel is the missing piece, or at least a missing piece, to that puzzle of solving pain. And we feel like these first people in our classes are going to be the leaders. These are going to be the people that, because part of our program, the pioneers, part of our program is research, is that they have to do a research project. So they will each become an expert on something as they come through the program. And that research will build and will publish, and this whole field will just explode.
This demands an open house. It really does.
Absolutely does.
I'm telling you.
You may be the missing piece to help expand the missing piece that is in pain treatment.
Totally.
You can visit the open house that Jerome mentioned, the Center for Neurosomatic Studies, this Saturday from 1 to 3. There's the address for you, and of course we're going to be posting that at studio10.tv. It's in Clearwater, and you can go to cnstudies.com to learn more.
Randy Clark and Kevin Wade, thank you so much.
Our pleasure. Thanks for having us.
Can we keep the pelvis? Because Elvis Week is next week.
It is.
Are you going to take the pelvis?
Attached to my
make it shimmy.
I wanted to keep the pelvis.